You're listening to the Sex and Psychology Podcast, the sex ed you never got in school and won't get anywhere else. I am your host, Dr. Justin Miller. I am a social psychologist and research fellow at the Kinsey Institute and author of the book, Tell Me What You Want, The Science of Sexual Desire and How It Can Help You Improve Your Sex Life. One of the biggest sexual concerns that men have is whether their penis is big enough. For example, in a study of more than 25,000 men ages 18 to 65, nearly half of them, 45%, said that they were dissatisfied with their penis. And among those who were dissatisfied, they almost universally wished that they were larger. Very few men wish that they had a smaller penis. So, with few exceptions, penis size concerns typically only go in the direction of wanting to be bigger. A lot of this penis size anxiety stems from the fact that people think that the average penis is much bigger than it really is. And the reality is that most guys who think they're small are actually well within the normal range. And some of the guys who think that they're too small are actually well above average. Even so, many of these guys still want to be bigger anyway, and some of them are going to great lengths in order to make it happen. So in this episode, we're going to do a deep dive into the world of penile augmentation. We're going to talk about the various approaches that are out there, which ones are supported by the science, some of the potential risks and side effects, as well as what you really need to know if you have penis size concerns. I am joined today by Dr. Joshua Gonzalez, a board-certified urologist who is fellowship trained in sexual medicine. He is a sexual health advisor to Astroglide Lubricants and serves on the board of directors for the International Society for the Study of Women's Sexual Health. He is also one of the co-founders of the sexual wellness brand Popstar, which creates science-backed products to support male sexual health and pleasure. This is going to be another fascinating conversation that you won't want to miss. Stick around, and we're going to jump in right after the break. Are you looking for a space that celebrates diverse perspectives, explores new frontiers, and brings all of your favorite people together? The annual Sexological Conference, hosted by Sexual Health Alliance, is where sexuality leaders gather. This conference connects you with world-class experts, leading sexuality companies, and a community of like-minded, passionate, and welcoming professionals. You'll find your people at the Sexual Health Alliance Annual Sexological Conference this October. Get your ticket to be inspired, educated, and empowered. Note that this conference is open to anyone and everyone. Head over to sexualhealthalliance.com, select the Annual Sexological Conference page, and save your spot today. Hi, Josh, and welcome to the show.
Hi, thanks for having me.
It's great to have you here. So we're going to be talking all about penis size today and whether there's anything you can do to increase it. So we know from surveys where men are asked how they feel about their penises that about half of them say they're dissatisfied, and almost all of them say they wish they were bigger. There's only about 1% to 2% of men who say they wish they were smaller. Now, a lot of the guys who think that they aren't big enough, most of them actually have perfectly normally sized penises to begin with, but they've been led to believe that they're too small, perhaps because they're trying to measure up or compare to penises that they see in porn. So let's start there. What would you say is average in terms of penis size? What's the typical range?
There's mixed data on this, and it tends to vary by nationality, essentially, and where someone's located geographically. But on average in this country, it's about 5.5 is usually what I share with my patients. There's some measurements that are slightly above or below that, but around 5.5 inches erect is what we would consider a normal sized penis.
Yeah. And there's certainly a range. There's not just one typical penis, right?
I wouldn't have a career if that were true.
Yeah. I think when we're talking about normal, quote unquote normal, when it comes to penis size, we're always talking about a range and not one specific number. So whether you're a little bit below or above, you're still average, right? So I think the reality is that porn and lots of other things kind of have skewed our perceptions, and people actually think the average penis is bigger than it really is. So in studies where you ask people, what do you think the average penis size is? It tends to be quite a bit higher than, what we see on the actual surveys and data and measurement.
Yeah.
So there are a ton of products on the market promising to increase penis size. So let's talk about what does and doesn't work. Now, no matter how much education and reassurance we give to guys, there are going to be a lot of them who still want to increase their penis size anyway. So I think it's important for men to have accurate information about what really works so that they can make informed decisions. So let's start with perhaps the most widely advertised option, which are the pills and potions that promise to increase your penis and add inches to it. Are these things just gimmicks, or is there any evidence that you can take a pill to increase penis size?
Not that I'm aware of. The only pills that I would say could help with like penis health or penile function are like PDE5 inhibitors, medicines like Viagra and Cialis. Those are really working to increase rigidity or improve rigidity. They're not going to necessarily increase your size. We do put some men on like a low dose daily Cialis, sometimes to just help with generalized blood flow. And I do have some patients that will report that their penis just at baseline feels a little bit more full.
Mm-hmm.
But most men, when they're talking about size increase, they're focusing a lot on length and girth in the erect state. And there's no evidence to suggest that even those medications, which have been well studied, been around for almost 30 years at this point, that they increase erect length or increase erect girth.
Yeah. So if you see pills advertised on late night infomercials or in gas stations, these things are not going to work as promised.
They might actually be dangerous. There have been some studies that have looked at some of the ingredients in these kinds of gas station online available pills. And sometimes they're filled with pharmaceutical agents that patients may not be a good candidate for, could have reactions to. They've found rubber in them. So they can have harmful substances or ingredients that could put you at danger.
Yeah, so buyer beware when it comes to these pills and potions that are sold to increase penis size. But I appreciate you bringing up the point about Viagra and those other drugs that are often used to treat ED, which can work in terms of helping you to maximize your size because they're promoting healthy blood flow. And particularly like as you get older, even if you don't have ED, that can help to make sure that you're showing up at your biggest size possible for your body. But it's not actually going to make your penis literally bigger in the sense of adding inches to your length or girth.
The one point I guess I would add to that would be that these medicines in the PDE5 inhibitor family, Viagra, Cialis, and the like, because they're keeping a healthier amount of blood flow to the area, they can sometimes prevent atrophy, which is a natural thing that happens to everybody as we age, right? Our muscles atrophy, they get smaller over time. The smooth muscles in our penis also atrophy. And so we use these medications, especially in patients who have undergone pelvic surgery for prostate cancer, bladder cancer, where the blood flow to the penis gets disrupted. We'll often put men on these medications prophylactically to prevent atrophy from happening. So it's always better to get on a treatment or seek help before you start noticing a problem, and can sometimes use these medications almost preventatively.
Yeah, so they can help you to maximize your size and also preserve your size as you age. So next, we have the penile exercises and stretches. So there are tons of articles online and lots of online forums dedicated to something people refer to as jelqing, which is a manual penis stretching technique. And there are also lots of penis stretchers on the market that you're supposed to wear for several hours a day that supposedly increase your penis length over time. So what do you think of this? Can you stretch your way to a larger size?
I would say yes and no. So there is a device that I recommend to my patients that has been well studied. It's been studied primarily in men with a condition called Peyronie's disease, which is when you develop scar tissue in the fibrous tissue that surrounds the corpora. And that scar tissue can often present with a curve, but some men with Peyronie's don't have a curve. What they get is shortening because their tissue cannot expand as much because the area where they develop scar tissue is kind of restricted. So their penis gets bigger, but in that area, it can't fully stretch out. The device is called the RestoreX, and it is a device that was developed at the Mayo Clinic, has multiple clinical trials showing safety and efficacy in men with Peyronie's. And so for men that I see that are interested in increasing length and are open to using a device and have the time to say use it twice a day for 30 minutes, I think it is a safe device, and I will sometimes point them in that direction. I'm not really aware of any other devices available that you can get through other suppliers or Amazon or sex shops that have the same proven track record in terms of safety and efficacy. So I would, again, buyer beware and encourage people to avoid those, because I have seen patients aggressively jelq or hang weights from their penis or use these other devices that haven't really been studied in a clinical setting, who end up hurting themselves and causing a problem that wasn't there before, just in the hopes of gaining some length.
And that's the unfortunate side of the penis enlargement industry is that you have all of these products and devices out there, and a lot of guys don't follow the instructions that come along with it, or they do it too aggressively, or it's just a device that doesn't work. And sometimes people injure themselves, and sometimes it ends up actually resulting in shortening of the penis, depending on the type of injury that occurs, which is a pretty terrible outcome for somebody who was hoping to increase their size. And looking at the data in terms of what actually works when it comes to increasing penis size, there is a small amount of evidence for stretching just in general, but it doesn't really lead to really large gains, right? And also all of the studies that are out there are based on really, really small samples. And so you kind of have to take it with a grain of salt, but there is some minimal evidence that maybe stretching can help add a little bit. It certainly seems to be more effective than some of the other methods that are out there. But again, you really need to be careful about the specific device that you're using and be sure that you're following the actual instructions for it and don't try to stretch too much or too quickly.
Exactly. I agree with all of that. A point that I would add to that is we use the RestoreX, as I mentioned, in patients with Peyronie's disease. Sometimes I will encourage patients to look into using that regularly, even if they don't have Peyronie's, if they just want to see some mild increase in their length. We also use it as part of a protocol, which is called the P-Long protocol, was developed by a urologist in Northern California, which is essentially is like PRP injections, platelet-rich plasma injections into the penis. So for your listeners who don't know what that is, platelet-rich plasma is essentially your own blood. We draw someone's blood, we spin it, and it separates into serum and plasma. You take that plasma out, has a lot of growth factors in it, and then you inject it into an area of the body that you want to sort of enhance or regenerate or improve the function of. So we use it in the penis to help improve the function of the erectile tissue. It's used in dermatology to promote collagen production. It's used for hair restoration. It's injected into joints. So it's a substance that's used all over medicine. But we do this protocol in our office, which involves monthly PRP injections. And then at home, people use the RestoreX stretching device twice a day. They use a medical grade vacuum erection device, and they typically will take a daily nitric oxide supplement to sort of get more blood into their penis. But it's really that combination of things that has been shown in a study that was published to increase length. Now, again, that's a lot to do. So it's really important to keep a perspective as to what like expectations you should have in terms of gains. After 6 months of doing twice a day, exercises with these devices and coming in for monthly PRP injections and taking a daily supplement, men saw about 0.85 inches in length. So for some men, that's a lot of work for not a lot of payoff. But there are a lot of guys who say, like, listen, if I can get to almost an inch increase in length, that's worth it to me. And they're willing to sort of put in the time and the effort. So that is one area in which I think the stretching does have a little bit more promise, but you have to combine it with all of these other modalities.
Yeah. And I think that's usually true of most things when it comes to therapies is taking some type of multimodal approach where you're hitting it from a lot of different angles. But yeah, I think that is an important point that you need to have realistic expectations going in. If you're going to try any of these things, you're not going to add inches to your length. Maybe you'll add centimeters, but again, realistic expectations I think are really important. And, for some people, having an extra centimeter or two could be a very important thing to them. Whereas for others, that might not be seen as worth the effort and the expense, because with all of these things, you're going to have a certain cost that's associated with it too. Is your sex life feeling monotonous or disconnected? I've been there before. Most people in long-term relationships will eventually find themselves approaching intimacy on autopilot and get stuck in a routine. But what if I told you there was a way to break out of the rut, bring the spark back, and unlock deeper intimacy? That's where Beducated can help. It's an online resource featuring over 100 expert-led courses designed to put the spice back into your sex life and strengthen your connection. One of my favorite courses is called The Sex Audit, and it will walk you through the entire process of doing an audit of your intimate life that culminates in a healthy and productive conversation with your partner. It teaches you how to do a check-in with yourself first to figure out what's working and what isn't, so that you can tap into your deeper needs and desires before sharing these with a partner. This course also guides you through how to actually have that conversation in a supportive way that fosters meaningful connection and understanding. That's what I really love about their courses. they don't give you generic advice like communicate more. Rather, they actually show you how to communicate. Say goodbye to your dormant sex life and hello to a sex life reboot with Beducated. Beducated is where toe curling pleasure meets expert-backed education. Get 50% off the yearly pass by using my last name, Laymiller, as the coupon code. Try Beducated risk-free with a 14-day money-back guarantee. What are you waiting for? Check the show notes for the link and be sure to use my last name to get your discount. Now, you mentioned penis pumps, and that was actually going to be my next question. Penis pumps are designed to draw more blood into the penis and keep it there. And my take on these things is pretty similar to the erectile dysfunction drugs, which is that they don't necessarily make your penis bigger in and of themselves, but they help make you as engorged as possible. And they can help in terms of preserving your size. I know penis pumps are often used for people who are undergoing penile implant surgery and other things where it can help them to maintain their size after the procedure. So is that sort of what your take would be on penis pumps as well? Is that they're kind of helping you to maximize your size, not necessarily add significant length to it?
Yeah, I would say outside of the P-Long protocol, the only times I'm really recommending penis pumps, and again, there's a wide variability in terms of what people consider penis pumps. I usually recommend the Joel Kaplan vacuum erection device, which is kind of a medical grade penis pump, or something that you can get through like a good pharmacy that is selling medical grade quality devices. You don't want to just, go to your local sex shop and pick up whatever they have on the shelf, because who knows what you'll be using. Again, we're all about preventing harm here, right? We don't want to make you have a new problem just with the hopes of getting a bigger penis. But outside of the P-Long protocol, I would say we use vacuum erection devices in post-prostatectomy patients, post-bladder cancer patients. So anyone really having a pelvic surgery for the same reasons that we put them on PDE5 inhibitors. It's sort of preventative or to allow them to maintain their size. Or in patients, like you said, who are undergoing penile implant surgery. I don't recommend regular pumping for my patients and often try to discourage them from doing so. I have a lot of patients that come to me already using that because over pumping can cause problems of like ecchymosis, where you develop capillary break. And so you get deposits in the skin that can change the color of your skin, make you look kind of blotchy. And, that's not something that people like aesthetically. And it's not something that can always be fixed. So once it happens, it's sort of stuck with that skin discoloration.
Yeah. So when it comes to penis pumps, you want to be careful in terms of the product you're buying and also how you're using it. And again, just like with the stretching devices, don't want to overdo it because sometimes you can cause more problems than you solve. And, related to penis pumps, there are also penis rings or cock rings that you can use. Again, these don't increase your size in terms of like adding inches to them, but they help you to maximize your size. Again, the thing you have to be careful though of when you use penis rings is that you don't wear them for too long because that can create another problem and can lead to death of the penile tissue. So, with all of these treatments, you need to be careful.
And no metal cock rings, please. I've had to cut them off, and you don't want to be someone who gets a metal one stuck on and has to get it cut off because it's incredibly painful.
Yeah. If you're going to use a cock ring, do something rubber, plastic, stretchy that's, easy to get on and off. So in the last 10 to 20 years, there's been an explosion of surgical techniques to increase penis size, from implants that go under the skin of the shaft, to fat injections, to cutting the suspensory ligament that anchors the penis to the pubic bone, thereby allowing more of it to hang out of the body. Something I think a lot of people don't realize is that a big chunk of your penis is actually internal. And so basically what that surgery does is it just allows more of the penis to be outside of the body, but that can create another problem, which is that you'll have a wobbly erection because it's not anchored to your pubic bone and can increase the risk of penile fractures. And also the angle of your erection is going to be different after something like that. Now, I know there are a lot of doctors promoting these surgeries, but I also know there isn't a lot of great data out there on the subject. So I'm curious for your take as a physician. What do you think of penis enlargement surgery?
I am not a fan. And I am a penis surgeon. I mean, as a urologist, that's what my training is in. Because I don't think, like you said, there's very limited data on not only efficacy of these treatments, but really safety data. I've seen when things go wrong. I've seen infections of some of these implants which is a disaster. It requires removal of that implant, which results in scar tissue formation and often can result in penile shortening. And if someone is going through this whole process to make their penis bigger and ends up with a shorter, more fibrotic penis, that's a pretty terrible outcome. And it's not like I've just seen it once. I mean, I've seen it happen multiple times. You mentioned the suspensory ligament procedure, which I think thankfully has kind of fallen out of favor. I think it was kind of more popular maybe like 20 years ago. And all it's really doing is making your flaccid penis bigger. It's not really going to do anything for your erect length. That is something that is fixed by the length of your corpora. And that's something I think that people don't understand. Yes, 50% of your corpora is internal, but your corpora from the tip of your penis all the way to the most internal portion is a fixed property, except for maybe being able to stretch it by a little bit over a long period of time. So the suspensory ligament surgery is really just going to make you more of a shower. But the consequence is that, as you mentioned, your erection is probably not going to be as strong. The angle is going to be at best kind of straight out and or pointing down, which can make penetrating a partner very challenging. And it can put you at increased risk for things like penile fracture, like you mentioned. So thankfully, I don't see that much anymore. And that procedure also runs the risk of damaging nerves. So people will sometimes develop lack of sensation or decreased sensation in their penis. It can damage vital vascular structures. And so sometimes people will develop erectile dysfunction from these procedures. So it's definitely not something I'd recommend. At the end of the day, I always try to balance safety and efficacy. And there's just not a ton of data to go on. And so I focus probably more on safety. And the only treatments that I really offer in my office are things that I think are very safe, are not going to put people at risk for loss of sensation or erectile dysfunction, and or maybe something that can be reversed if necessary.
I wish more doctors were like you, because you have a lot of them out there who are doing some, pretty risky, untested procedures. And I think, if you look at the current state of the science on penile enlargement surgeries, it's still very much considered to be risky and experimental, and we don't have great safety and efficacy data for these things. So it's something that you would want to be really, really cautious about if you're talking about doing surgery on the penis to try to increase size, because we just don't have great data on it, and there are lots and lots of risks that come along with it. So I wanted to ask about dermal fillers. So I've increasingly heard about them being used as a way of increasing penile girth. So do they actually work?
Yes. So that is one of the penile enhancements in terms of size that I offer in my office that I would say is incredibly safe. So for your listeners that don't know what that is, when we talk about dermal fillers, we're talking about fillers that are very similar to where people add volume elsewhere in the body. So when you see people who've plumped up their lips or they add filler to their cheeks, these are dermal fillers. The most commonly used fillers are hyaluronic acid-based fillers. Hyaluronic acid is a natural component of our connective tissue. That is the only type of filler that I use in the penis because it has an incredible safety track record. It's been used now at this point for decades in the lips and the face. It is considered off-label for use in the penis, but that doesn't mean it's not safe or efficacious. It's just an off-label use. But again, this goes back to what I just said a minute ago. I'm looking for treatments that are very safe and can be corrected. And the beauty of hyaluronic acid filler is that if there's an area that ends up looking a little uneven, which can happen, it's not super common, but it can happen, we can inject that area and finally sculpt that area by injecting an enzyme called hyaluronidase, which helps to soften or partially dissolve a small amount of filler just in that one area so you can make it look even with the surrounding tissue. So that is something that I offer in my office. It is definitely effective. It takes a lot of volume. So most people, when they're injecting their lips, they're using half a syringe, 1 cc, 2 cc's of filler. That would be a lot in those areas. In the penis, we're often having to use 5 units, 10 units, 20 units, sometimes even more, depending on how much size someone wants to see.
So I've been reading and hearing more about the use of dermal filler for penis enhancement. And I've also been reading more articles about where it's gone wrong. And I suspect that in a lot of those cases, it's from practitioners who don't really know what they're doing, haven't been trained in it. This isn't going to be part of your standard medical training, right? So I think if you're going to have fillers injected into your intimate areas, you might want to really do your research and make sure that, the person who is doing it is experienced and knowledgeable about this. I think too, another risk here is that sometimes people overfill. I think when it comes to penile enhancement, some people want to go the biggest they possibly can. And sometimes that might be too much and that can create issues with function. So I think, if you're going to go down this route, it's best to maybe do it in a more gradual way. Maybe don't try to plump it up as big as you possibly can on the first go around.
Yeah, I totally agree with that. That's exactly how I approach this with my patients. We in my office do something called the fallow fill enhancement, which is a technique that only a select group of providers around the country practice. Most of us are urologists. I would recommend that if you are considering a penile enhancement procedure with dermal filler, you go to a urologist who is well trained in the anatomy of the penis. There are vital structures in your penis that you do not want to injure, including nerves, arteries, veins. Again, you don't want to cause a problem with the pursuit of just getting a bigger penis. So with the fallow fill enhancement, we're adding dermal filler, but we sell different packages. And I generally try to encourage my patients to start with smaller packages. Not only is it less money out of their pocket, we can always go bigger. But if you purchase a package that's, say, 20 units up front, first of all, you might do it and not love it, which we don't see that very often. Most guys are actually very happy with the results. But I generally encourage my patients to start more conservatively, and we can build on top of that as we go. And I'm also pretty honest with my patients if I start thinking it looks weird or abnormal or unnatural, right? One of the things that people should know about the use of dermal fillers is that we're primarily putting these in the shaft of the penis, right? When you try to inject the head of the penis, that is a spongy tissue. What you end up creating is these little blebs, and you get a very unnatural appearance of the head. It's almost like a ridged appearance. It looks very strange. So it's not something that I recommend my patients do, and we don't do it here in my office. So when we are talking about increasing penis size with dermal filler, number one, we're talking about mostly girth here. So you're not going to really get much change in your erect length. The weight of the filler may help your flaccid penis hang lower. So a lot of guys are happy with that, right? They might fill out a Speedo or underwear better. They may feel more confident walking around naked, even in a non-sexual situation, but it's not going to do really anything to change their erect length. What it will do is change their flaccid girth and their erect girth. And that is accomplished by injecting the shaft of the penis. So you can imagine if someone has a smaller glans, they're going to be somewhat limited by how much filler they can add or how much girth they can add to their shaft without it looking unnatural. And I would say a majority of my patients appreciate my honesty and guidance in that respect, because I think most of them, at least in the market that I treat here in LA, they want a kind of more natural enhancement. There are some patients who kind of like that fetishy kind of exaggerated look, and, to each their own. But I just, always have the conversation with them when I start thinking that it's looking a little bit unnatural.
Realistic expectations are key here, and going to a licensed medical provider and not trying to do these things on the cheap. I've heard way too many horror stories of people trying to do cosmetic things and these other sorts of procedures just by going to whoever can do it the cheapest. And, then you don't necessarily know what you're getting and you see a lot of bad outcomes. So definitely go to somebody who knows their stuff. So one last question on this topic. What's your overall take-home advice on this topic of increasing penis size? For guys who are concerned about their size, what do you want them to take away from this?
I would say a couple of things. Number one, look up and understand what an average penis size is in the country that you live in to understand where you fall along that bell curve, right? We already talked about that at the beginning. So I think understanding what is quote unquote normal is an important thing to start with. Number two, I would say, ask yourself why you want a bigger penis. Is it because you think that's something that your partner wants? Is it something that a partner has maybe said to you previously that you feel insecure about? Do you think that it is going to enhance your sex life because you will feel more confident? If the answer to that last question is yes, I think it's completely valid to pursue safe treatments to increase penis size. Number three, I would say, what are your goals to increase the size of your penis? Do you care only about girth? Is length important to you? Do you want to also improve potentially your erectile function at the same time? That might help guide you in terms of what treatments you pursue. Number 4, skip surgery or anything that is irreversible or that could potentially cause harm. Number 5, seek out these treatments from urologists and other physicians that are well trained in the anatomy of the genitals, because I don't do filler in the face. That's not how I was trained. I don't think it's rocket science. I probably could do it, but it's not my expertise. And there are plenty of people that are going to do a better job of it than I would. So I think that penis filler is the same. And I think that we're probably the best trained to do it. And number 6, do your research. Just take a while. Don't make any rash decisions. Talk to multiple providers. I often will talk to patients and do a free consultation by phone if they call my office and are interested in these treatments, to just go over what the treatments entail, what to expect during them and after. There is some aftercare that is involved with the penile filler that I like to review with them. We go over risks so that they can come in here fully confident that this is what they want to do. So I don't think this is something that anybody should rush into.
I think that's all great advice, and definitely highlight, make an informed decision and do your research. So thanks so much for sharing all of this with us, Josh. I look forward to continuing our conversation in the next episode. Can you please tell my listeners where they can go to learn more about you and your work?
Yeah, so I'm on most social media platforms, primarily Instagram, TikTok, YouTube, at Joshua Gonzalez, MD. My website's also, I think, incredibly helpful at learning sort of what I do, the services that we offer here. There's a blog on that site. It's just joshuagonzalezmd.com. I'm also co-founder of a sexual wellness brand called Popstar. We have an ejaculatory health supplement to help promote ejaculatory health, as well as a delay spray that we just launched to help guys last longer. And that's popstarlabs.com. I work really hard, both with my personal brand and with Popstar, with a team of people to help to really provide sex education in like a fun, informative, disarming kind of way. Because I think a lot of people carry a lot of shame when they're not performing the way they want to. And our goal with my brand and with Popstar is always to help people understand what is real, what is normal, and just how to increase their confidence in the bedroom.
Love all of that. And I'll be sure to include links to all of that in the show notes. So thanks again so much for your time. I really appreciate having you here. Thank you for listening. To keep up with new episodes of this podcast, visit my website, Sex and Psychology, at sexandpsychology.com, or subscribe on your favorite platform, where I hope you'll take a moment to rate and review the show. If you listen on Apple Podcasts, please consider becoming a Sex and Psychology Premium subscriber to enjoy ad-free listening for just $3.99 a month. You can also follow me on social media for daily sex research updates. I'm on Blue Sky and X at Justin Lehmiller and Instagram at Justin J. Lehmiller. Also, be sure to check out my book, Tell Me What You Want. Thanks again for listening. Until next time.